Hey, thank you for coming out to Utah. I'm sorry you've been on this journey that you didn't sign up for. The good news is that problems can be solved. First of all, let's take a look at your CT. Things look pretty good here as far as the implant placement. Nothing that I see that's way outside. I wish this implant was back further. I feel like the implants are in pretty good shape. A little bit of translucency right here, but if there's no signs of any infection, I wouldn't worry about it. What you notice when you're talking is that you see a lot of lower teeth. That indicates a couple things. Your plane of occlusion needs to be lowered so you show less lower teeth. You don't show much upper teeth. You don't like the way they feel and look is because everything's been pushed out. Everything's been pushed out so that you have a big ledge on the top. It's almost like a little gutter that food gets caught in. Those impressions were taken early on when you weren't fully healed. When we take calculations, and we're certainly going to make sure that those teeth come out at the proper angle. The gums don't have a gutter, meaning like a little ditch that food stays in. You mentioned that they said they couldn't push the teeth back, and that's actually not true. I think it's because they were constrained to the titanium bar that was made, I think maybe a little prematurely. And so what I was doing is I was looking and seeing, okay, do we have the room to be able to push back the upper teeth just a little bit, but the lower teeth for sure, so that they gives you more of a natural look, so that your lips don't feel like they're hanging out there. I can see as you're like moving your muscles, I can see that your lips are getting hung up there. See that big ditch? So that's not natural. 90 degrees is not natural in the mouth, and that's why it drives you crazy. You can see why the lower it doesn't bug you quite as much, because you see a gradual emergence as it leaves the gums. You mentioned that you're biting your cheek, and your teeth are very end to end, and so we need to correct that also. Natural. You can see how right below the nose it sinks in. We would make that look natural again, especially on the lower. See how it comes out? It has a little dip. That's not natural looking. We would improve both these by bringing back the teeth and putting the lower arch within the upper arch so that you don't catch your lip and that your front part of your lips feel they're natural. We sent you home with a document that talked about the fees, talked about pricing, and timing. And so the next step would be documents where we sign consents, we go over all the information. You don't have to do that here in Utah. The second visit would be where you come in and we do calculations. You come in, likely be like flying on a Sunday, we start on a Monday and do calculations. We would scan your teeth, scan your implants, and then we would make you a template, and you could wear them for a few days. And then once you are confident, then we would have you sign cosmetic consent that basically says, I like these, they're good. And then we would make your final zirconia device, which usually takes 2 or 3 weeks. You can have some options here. You can come out and stay here and just do it in one visit. And if you're willing to stay here for a couple weeks and just get an Airbnb, and that would be fine. If you have time, that might be a great option for you. But if being away from home is stressful or can't do it because of work, then we could do it in a couple visits. A lot of patients that are really busy, they'll just fly in a few times. You're tired and you're exhausted, you're frustrated. It would be a pleasure to help you. So I'm so grateful you came out. I hope that you see that I do care. I hope this video helps you understand what's going on in your mouth, and it helps other doctors. And in the case you do choose someone else, the hardest thing in dentistry is communication. I try to spend a little bit more time on the communication side. And I think if we're all super clear, the end result is a happy patient that is able to live a life that's full of great food and lots of smiles and more moments that make life worth living. I'm grateful for you coming out, and I wish nothing but the best. God bless you. We'll see you soon.